One of 500 to 700 newborns is actually born with a cleft lip palate malformation, and during pregnancy, during the 6th to 12th week, tissue grows together, and if this does not happen, the baby will be born with a cleft. My name is Benito Benitez. I am a maxillofacial surgeon, and now I'm here mainly in the team involved in treating our youngest patients with craniofacial malformations, and for most part of it is patients born with a cleft lip and palate anomalies. From the very beginning I wanted to do some handcraft work. Then I followed that through dentistry, which is very handcrafty, and then through medicine and surgery, and maybe I ended up with a micro thing again, with the small children, yes. We have a long tradition here in Basel to try to reduce the burden for these children, but also for the families. So since a long time, trying to operate these babies just one time, it is in the first year of life, and to restore form and function again before the baby tries to speak. After birth, we do a special plate with the aim of holding the tongue out of the cleft, because the baby has this cleft since many months during pregnancy, and the tongue goes into this cleft and keeps the cleft wide. So what we want after birth is actually to change this function, that the baby keeps out the tongue from this cleft, and this also helps us to get the cleft of the palate reduced, and then it allows us to close the whole malformation in one time. It is also a nice tool to get parents involved in the treatment. So we basically do these impressions, give them the plate, and we instruct them, and then what you do, you once a day remove the plate, you clean it, and you clean the mouth, and you put it back in, and then it stays until the next day. And one mother told me, yeah, it's like brushing the teeth. Later on we will need to do that also. And I thought, yeah, okay. At the beginning, parents, they might have fear, but then suddenly they become experts and they can engage with the child. They can do something for the treatment, and it can make surgery easier for us. So I think it's a nice teamwork. Previously, what we did is we needed to go to the newborn and take a conventional impression, like with the dentist, which is stressful for the baby, stressful for the parents, because it's an airway endangering procedure, because some of the material might go back to the airway, which is dangerous. And I also know centers abroad which actually stopped of doing these impressions because they had severe complications in some cases. This was basically the main first aim, to get rid of this endangering procedure and replace it by a digital contactless impression taking. What we do, we just scan the deformity inside of the mouth of the baby to capture the cleft deformity. What you can see is that we can precisely capture, let's start here by the nose deformity. Here is the right side, here is the left side. You see the cleft of the lip, and you can look here into the nose. Once you change the system to a digital impression, is what you get. You will not get the physical model, you get a 3D model, and you somehow need to have it in your hands. So then you also need a workflow how to get this model. And we have in-house, a point-of-care 3D printing facility. We can directly print the model, but we further can do computer-aided design and design some presurgical plates for the patient and print them directly also with some with biocompatible material. To achieve the best care, most important point for me is patient safety. So if you can reduce the risk for the patient, I think it's worth to try.